project purpose. So our project purpose is to expand agency leadership's capacity to support employee mental health, to build direct care professionals' resilient skills by increasing awareness of mental health self-care, and to provide resources to help sustain and strengthen the current workforce to limit staff turnover. This project was funded through the Administration for Community Living, and we partnered with the Institute on Community Integration. This is our third implementation of this series, but we're including new speakers, new strategies, additional topics, and new sessions. This series has 3 focus areas with sessions tailored towards creating an organizational culture that supports mental health, supervisor strategies to mitigate and prevent employee burnout, and evidence-based coping strategies for stress management and building personal resilience. Before we begin, we want to describe an ECHO session and what sets us apart from the other trainings. In essence, ECHO sessions allow us to move information, not people. It allows you, the participant, in your own space to actively learn about a topic and ultimately also become a resource for your community. Each session, there will be a formal didactic portion on a designated topic, followed by a case presentation. This is an opportunity for a participant to present a case of a real-life scenario and get feedback and resources from our content specialist, as well as the other participants. This is an excellent opportunity to learn about new resources and ways to assist your employees, and in turn, the people you work with every day. We encourage every participant to take part in the case presentations during the group discussions. You can do this by unmuting or using the chat. And also, please consider presenting a case presentation in an upcoming session. If you're interested, we can provide that information for you. Your participation is key to the success of our ECHO sessions. We aim to create an interactive community where our presenters, stakeholders, and community members all communicate and support each other during a session. We encourage everyone to turn on your camera throughout the session as long as you're comfortable doing so. We appreciate participants engaging and asking questions after the didactic and providing feedback for the case presentations. The case narratives are the best way to solidify skills learned in the didactics and receive direct advice. So feel free to put any questions in the chat and we can address them at the end of the presentation. You can earn professional development, social work, or nursing credits and certificates of completion for your participation in the direct care resilience sessions. To receive this credit, fill out the evaluation that we will send to you after each session. You can also access these evaluations anytime through the iEcho platform. Now for some housekeeping items. To set up your iEcho account, we will send a registration link to your email from noreply@iecho.org. Please check your junk or spam folders if you did not receive this email prior to the session. In the past, some participants have experienced issues with organizational firewalls. So if you have any issues, I'm so sorry. If you have any issues with that, please reach out to us and we will help you troubleshoot those issues. iEcho is an essential tool for anyone participating in an ECHO program. It allows you to access all the content covered in the series, as well as finding other ECHO networks throughout the globe. And I apologize for my cold. I know my voice isn't very pleasant right now. So for introduction, we have our ECHO team logged in today, including myself, Jody, and Kyle. And if you need assistance throughout this ECHO, you can reach out to any of us, and we should be easy to find with our ECHO backgrounds behind us. And our other final member of the ECHO team today is also our presenter. So please join me in welcoming Krista Opstedal. Krista is a research associate at NDCPD. She started her career as a direct support professional, which has helped her understand the challenges and aspirations of those she serves. She has served in various roles such as coordinator of assistive technology and Project ECHO director, which have positioned her to advocate for equity and inclusion for people with disabilities. Krista holds a master's degree in public administration and has 15 years of experience in the disability field. She is passionate about mental health and well-being, which stems from personal experience with the devastating effects of losing a loved one to suicide. This experience drives her commitment to helping workplaces reimagine the organizational culture as an engine for employee well-being. And so with that, I'll hand over the controls to Krista.
Thanks so much, Jessica, and welcome everybody. We're excited to have you at our series. Like Jessica mentioned, this is our third implementation of the Direct Care Resilience Echo series, and we're just really excited because we have a lot of new content. And today we're going to be talking about supporting the mental health and well-being of the direct care workforce. So as Jessica mentioned, this series has three main focus areas, and this session particularly focuses on supporting mental health and well-being at the organizational level. So our agenda for today is to define compassion fatigue and burnout. We're going to highlight how the U.S. Surgeon General's framework can be used to establish and enhance a positive workplace culture. You can also find a copy of the Surgeon General's framework in iEcho under content, or if you go to the schedule for today's session, you'll find it under there. And then we're also going to provide some strategies for replication. Here at NDCPD, we've actually utilized this framework to try to enhance our own culture here at the center. So we're going to provide a case presentation of our efforts there and give you some strategies for how to do it in your own organizations. So why does this matter? According to the American Psychological Association's Work and Wellbeing Survey, 92% of respondents said that it was somewhat or very important for them to work for an organization that provides support for employee mental health. 95% also said that work, which really does go hand in hand with supporting mental health. And in the context of DSP, so those direct support professionals that are working with people with disabilities, Reliance and Anchor completed a study in 2023 and found that almost 2/3 of the respondents reported that they'd be moderately to extremely more likely to stay with their company if that company had invested in employee well-being or mental health programs. But that was interesting because only 52% of the respondents said that their organization had such programs, and 35% weren't sure if their organizations offered those programs. So there's still some room for improvement and traction that can be started with these types of initiatives. And I think it's important to note the current state of the direct care workforce. And I know I'm definitely preaching to the choir here because many of you have felt and experienced the staff shortages that we're facing in this field. But it has been captured through formal reports. The Institute on Community Integration did a report that found that DSPs have a turnover rate of 40 to 60% annually. And it's important that we recognize that this rate is really a lot higher than the overall healthcare and social assistance fields. Those fields had a 34% separation rate in 2019. And as we know, performance issues and these disruptions can have a negative impact on the quality of life and care for people with disabilities. The high rates of turnover with DSPs have been linked to injuries and hospital admissions for people with disabilities. This also contributes to more job stress for those staff who do remain in their positions, which also then contributes to more turnover and higher rates of incidences. It's just kind of a vicious cycle at this point. Now that we know the reason why we need to start considering this and start investing in employee mental health and well-being at an organizational culture level, we really should define what some of the conditions that DSPs face. So overall, we really want our staff to be resilient. And resilience is the process and outcome of successfully adapting to difficult or challenging life experiences. This is especially through mental, emotional, and behavioral flexibility, and being able to just adjust yourself if you have external and internal demands. And it's important to note that resilience also has some other attributes. This includes optimism, a positive self-concept, and the ability to remain hopeful, which is easier said than done. We live in pretty divisive times. You know, we have a lot of really negative news articles that are happening, 24/7 that can impact our mental health and well-being. The economic times can be really difficult and challenging for people, especially for our direct care workers that aren't paid the wages that they deserve. So it's hard to do this, but we're going to kind of talk about some strategies to help build up resilience. So on the flip side of resilience, two factors that really impact direct care professionals is compassion fatigue and burnout. And I want to highlight that this isn't the only thing that they're facing, but for the timing, or for the sake of time with this presentation, I wanted to just focus on these two concepts. So compassion fatigue is the state of emotional distress and exhaustion that results in a decreased ability to cope with the everyday environment. Compassion fatigue reduces the ability to empathize or feel compassion for others. It can happen to people who haven't been direct victims of trauma, but who have intense involvement with people who have. And research has shown that people with disabilities have pretty immense amounts of trauma, and it surfaces in everyday interactions sometimes. It's also important to note that there are several factors that indicate how vulnerable someone is to compassion fatigue. The first is definitely a combination of empathy and a lack of boundaries, which basically is me on paper. But when we're looking at our employees, this is one way that you can start assessing is those people that really, really care about the people that they're working with and maybe go above and beyond a little too much. They're probably more vulnerable to compassion fatigue than others. So on the flip side, we have burnout, and burnout's really often generalized, overgeneralized to describe exhaustion and fatigue in the workplace. But it's really important that we differentiate these symptoms because once somebody is actually in that phase of burnout, it's almost impossible to intervene with interventions and mitigate those issues. So burnout really is a prolonged response to that chronic emotional and interpersonal stressors on a job. This can lead to a negative job attitude, negative self-concept, and a loss of feelings and concerns for people. The key here is time. So we want to be able to catch compassion fatigue in its early stages. And I really appreciate this article. They had done a literature review and found a bunch of studies done on research or done on compassion fatigue, and they outlined the signs and symptoms of it. I personally like Boyle's definition of it, which is that second row down on that table. And some of the physical signs and symptoms include stomach pains. They might just have general aches and pains like headaches, muscle tension. They might be suffering from insomnia and just chronic fatigue and exhaustion. Some of the emotional signs and symptoms of compassion fatigue include sadness, cynicism, which I think is really interesting that Boyle included that. They might be oversensitive to any sort of feedback that they're getting from you. They might be easily frustrated or irritable. They might start blaming and becoming more judgmental towards their peers. They might also have a poor concentration, so not being able to just concentrate in meetings, and they might be forgetting small things like taking people to doctor's appointments or scheduled offerings. And they might also be self-medicating with food or alcohol. So we can't get into the minds of people. We can't feel what they're feeling, and we can't necessarily see all of this, but you can pay attention to the workplace performance issues that occur when people are having compassion fatigue. This includes an increased use of sick days, decreased productivity. They might be expressing that they're unhappy with their job. They might be having increased errors. Like I had mentioned, maybe you're seeing more medication errors that's not typical for this person. They might be forgetting appointments. They might be avoiding or dreading working with certain patients, and you might see higher rates of turnover in certain programs. So using the chat, are there any signs and symptoms that stand out to you that you were kind of surprised to see was tied to compassion fatigue? And I'll give everybody a moment just to kind of share their thoughts and cynicism. Yes, Amy. I honestly went through a deep dive when I saw that because I personally experienced cynicism when I was feeling compassion fatigue. And I agree, the physical signs are very surprising. I know when I've had compassion fatigue, I was constantly having headaches and stomach pains, but I was also really struggling with memory. Like I was someone who could remember everything that was said in a meeting like 3 months ago to all of a sudden I couldn't remember anything. And I honestly thought it was like having early dementia symptoms. Yes, and irritability, not wanting to go to work. Absolutely. Thank you guys for sharing your input. So we really want our staff to feel compassion, satisfaction. We want them to be happy in their jobs. We want them to have a good balance between work and free time. We want them to feel connected to people and also learning from the people that they work with. Some resources to get started. I'm not going to focus a lot on this because we are focusing more on like the organizational culture aspect of it, but I did want to provide you with some resources if you're interested. Credible Mind is fantastic. Our first district health unit here in Minot, North Dakota, has a contract with Credible Mind, and it provides a bunch of mental health assessments, and it'll populate different resources based on your results and like maybe some areas that you might be experiencing. And I really like the resources because they can range from like a 5-minute article to like a 20-30 minute podcast or a TED talk. So that's a really great starting point. I really like the 8 dimensions of wellness, and we do have a session dedicated to this topic in July. I think it's a really great holistic view of wellness. There's some links to some resources for self-care. And I do want to highlight that there is a difference between self-care and self-indulgence. We're seeing a lot of things on social media where people are like taking elaborate trips or like going and getting massage and pedicures, and it's like hashtag self-care. And that's honestly not what self-care is. Like those things are great. Those things are awesome. But self-care is actually really hard. Like self-care means that you have good sleep hygiene and you're getting enough rest at night. It means you have a balanced, healthy diet. You're taking care of yourself physically through exercise. And all of this is really challenging, especially if you are feeling compassion fatigue and all you want to do is crash on the couch when you get home from work. So there's a difference, but I also want to recognize the struggles that come along with it. And research shows that mindfulness is one of the most powerful tools to help with compassion fatigue. So you can find a little bit of resources there, but we do have a session dedicated to mindfulness later on in this series. So switching back to the workplace factors that can lead to burnout, the Mayo Clinic came up with this really great list, and it's kind of a good starting point to start considering what might be or what organizational factors might be impacting the staff in your programs. One could be a lack of control. So this is the inability to influence decisions that affects your job. Unclear job expectations, if people are unclear about the degree of their authority or their supervisor's expectations of them. Dysfunctional workplace dynamics can happen when employees feel undermined by their colleagues or if they're micromanaged by their superior. Extremes of activity. So if a job is like really monotonous, you're kind of doing the same thing over and over, or if it's super chaotic and it's constant fires that you're trying to put out, they both require constant energy to remain focused, which leads to fatigue and job burnout. Some people might have a lack of social support, and if they're feeling isolated at work or in their personal life, it can make the employee feel more stressed. It's actually really interesting. There's this epidemic of loneliness that the Surgeon General had released an advisory on, and they were saying that the impacts of loneliness is equivalent to smoking 15 cigarettes a day, which is mind-blowing to me. There's also work-life imbalance. So if a job takes up too much time and effort and the employee doesn't have the energy to spend time with family and friends, that's a one-way ticket to burnout. So it's really important for leadership to kind of assess these factors and see if there's any way that we can mitigate these issues or adopt some policies on ways to follow up if this is occurring. Some of the ways that we can do that is number one, which I think is honestly the most important, is acknowledging and accepting that compassion fatigue is an expected reality of this job. Self-awareness of compassion fatigue is really the first step. And a lot of people feel shame and guilt when they do start to feel that way, so they don't reach out for help. So if we acknowledge that it's inevitable, this will happen to you, and here's who you can reach out to for support, can make a huge difference in staff retainment. So one way that we can do this is educate the team on how to recognize the signs and symptoms. Like I said, I really like that Credible Mind mental health assessment, and they do have some caregiving measures in there to see if caregiving is taking in or is having an impact on your mental health. There's also surveys such as the Pro QOL that is specific to compassion fatigue. Number three, we can employ stress coping skills as a team because positive coworker relationships can alleviate compassion fatigue if you have someone that you can talk to and work through any issues with. We also want to ensure that leaders demonstrate social support because this is strongly associated with job satisfaction. Number five, we can normalize discussions on coping as part of regularly scheduled meetings, not just as a response to crisis. We can also be proactive in high crisis situations like abuse or death with interventions like making a counselor available or holding critical incident debriefings. If we are going to be holding debriefings, it's probably important to put it on your schedule to check in with that person a few weeks after the incident occurred because they might be in a state of shock and not really feeling the impacts of it right after it happens. So it's important to check in with them a couple weeks after it happened. And finally, we really want to emphasize the positive aspects of caring for people with disabilities and celebrate those positive encounters. So if you have a staff member who works with someone who hates going to the dentist and they support them to an appointment and it goes great, there's no incidences, that person felt calm and collected throughout that, just talk to that staff and say, hey, I really appreciate that you've been able to build some rapport with that person. I can tell that they really trust you and that um, appointment went great because of you. Those little interactions can just mean so much to our staff. So now we're going to kind of move on to the next portion of this presentation, which is the Surgeon General's framework. So in 2022, the Surgeon General released the framework for workplace mental health and well-being, and it really emphasizes that work is an important social determinant of health that can impact a person's overall mental health and well-being. And it has 5 essentials that are centered on worker voice and equity. And I really like this because there was a recent study that just came out like a month or two ago from Oxford University that highlighted that the most common workplace practices for mental health and well-being typically target individual employees. This includes EAPs, counseling services. There's a trend with offering resilience and stress management training, but this study found out that these individual interventions do little to actually enhance the mental health and well-being of staff, because you can have all of the great coping skills that you need, but if your workplace is dysfunctional, it's not going to help because you're coming into the same chaotic environment every day. So there's organizations like Mental Health America that recommends that workplace wellness initiatives being integrated within workplace infrastructure and culture, which aligns also with the Surgeon General's framework. So just giving you a little bit of context of why this is so great and so important. So we're going to kind of go through the framework. The very first essential is protection from harm, and this is anchored in feelings of safety and security. So we really want to prioritize workplace physical and psychological health and safety. So this encourages leaders to collaborate with workers to examine and eliminate any hazards. These efforts can include assessing if employees feel comfortable speaking up without fear of being punished or retaliated against or humiliated. This includes increasing access to workplace trainings and job tools in multiple languages, which is incredibly important for the direct support professionals because we have a very diverse workforce that come from different nationalities and may not have English as their first language. So if we can tweak our trainings to be offered in multiple languages, it's going to be more accessible to those that need to receive that training. We also want to examine the workload and adequacy of resources to meet job demands. So do we have enough staff, which obviously we don't, but can they manage their current caseloads? Is there anything that we can do to help with that? And finally, we really want to support mental health by decreasing stigma at work. This can happen by validating people's challenges, communicating that mental health and well-being as a priority, and then offer both support and prevention services, which also includes operationalizing DEI initiatives through your policies and programs. And I will highlight that DEI initiatives take a lot of time and subject matter expertise, and we have a couple sessions that talk about this in the future. So the next essential is connection and community. We can really start to build social connections by promoting positive relationships through welcoming, helping, and reassuring others. We can cultivate trusting relationships by creating structures and opportunities for employees to interact and better understand each other as a whole. This helps employees feel value and empathize with one another. And we know that research has shown having supportive work relationships can improve performance, and it's associated with worker engagement and innovation. Also in this is to foster collaboration and teamwork. So the future of work, it includes hybrid and remote work. So if you already have embarked on that and you have remote workers with your in-person workers, organizations really need to be intentional about how to build those teams, communicate and collaborate. If you haven't already considered this, I think it's really important to consider a hybrid work model for those program coordinators and case managers that have a lot of administrative reporting requirements that typically you just can't get done in the office. So consider having 1 or 2 days a week designated so that that employee can work from home so that they can get those administrative tasks done without interruption and putting out those fires that will just help their mental health and well-being in the long run. And I do want to highlight that next week's session I'm really, really excited about. We have some presenters from the University of Iowa who are going to talk about this in more depth about creating those cultures of community and belonging and cultivating trust in relationships. So we hope that you're able to join us next week as well. So the third essential is work-life harmony. This includes autonomy and flexibility. So research shows that organizations that increase worker autonomy, or how much control they have on how they do their work, and also workplaces that have greater flexibility have workers that are more likely to succeed, and they're also retaining staff for longer. So some ways that we can increase autonomy in direct support work is allowing experienced employees to organize and communicate their work and mentor other staff. On the flip side, we do still want to provide constructive feedback if there's any sort of inappropriate actions, just to help redirect their practices. So just because somebody is really great, they still do need some mentoring here and there. We can also ask our DSPs for contributions to person-centered plans, like asking them if the goals make sense and are meaningful to that person. We want to make sure that schedules are as predictable as possible and that people have access to paid leave, and respecting boundaries between work and non-work time, which I know is really difficult because we're constantly trying to fill shifts when people are calling out. I guess my advice is, if you know that somebody's on vacation, maybe leaving them out of that text change so that we're not interrupting them. I actually had to practice this morning. I needed something from Kyle, but I knew he was out this morning, so I had to just try to work through it myself because I didn't want to bother him knowing that he was out. All right, now the fourth essential is mattering at work. And this is anchored in dignity and meaning. Dignity is the sense of being respected and valued. So if the dignity of workers is affirmed and supported in the workplace, it really enhances well-being. But if people feel like they're disrespected and they're not valued, this is going to increase stress. It might increase feelings of anger, cynicism, hostility, and withdrawal, which we also saw are similar symptoms with compassion fatigue. So what we could do is engage workers in workplace decisions, having like little focus groups in town halls so that they have a say and voice at the table. We can also build cultures of gratitude and recognition. Supervisors play a really powerful role in shaping culture and employee well-being. So it's just important to note that if people feel appreciated and recognized and engaged by their supervisors and work and coworkers, their sense of value and meaning increases, as well as their capacity to manage stress. And like I said, this doesn't have to be anything big. It doesn't have to be big presence or during meetings giving people shout outs, because some people hate that. It can really just be those like small interactions, text exchanges that can make people feel that they're valued in the organization. Finally, we want to connect work with the organization's mission. It's really important because having a shared purpose or a collective sense of working towards a common goal really helps assign further meaning to the work. It helps generate pride, it fuels motivation, and it reduces stress. So leaders can really reinforce these connections by acknowledging the different roles of individuals, teams, and departments in achieving the organizational goals. And finally, opportunity for growth, which is anchored in learning and accomplishment. This includes offering quality training, education, and mentoring. This might look like having rotations through different departments, being offered new types of responsibilities or assignments that gives people an opportunity to stretch their skills or to learn new ones. We also want to foster clear and equitable pathways for career advancement. And the research has shown that organizations that create more opportunities for genuinely engaging with their workers, especially in ways that's positive, collaborative, and outcome oriented, increases mental health and well-being. So this means that leadership should be equipping especially like new or mid-level supervisors and managers with supportive training tools and resources so that they can actually engage, manage, and lead and coach their staff. So I want to take a moment to just pause and let me know in the comments what's on your mind. Do you have any questions or any like aha moments or takeaways before we move on to our case presentation? We'll just give everybody a minute there. I can put on some music if that feels better when we're trying to get our chats going and getting our thoughts on paper. Thank you, Tanya. She said, thanks for sharing a lot of valid points. Would like to see this implemented in more agencies. And we're going to kind of discuss that a little bit in the next session, or not next session, in the next section of this presentation. Karen says that she agrees with the 5 essentials for workplace mental health and well-being. She likes this list. I agree. I was blown away when I first saw this. I think it was very well researched, and like I said, you can find a copy of the Surgeon General's framework in iEcho. We'll also send it out after this presentation with some additional resources so you guys can actually check out and see what all it has. With it being a framework, it is a little bit more loose because it's meant to be used as just some kind of guiding steps to get started. Sydney says that they like managers working from home idea. They have a manager every Wednesday and they tend to get distracted by interruptions on their one day to get their duties completed. Absolutely. I recently, well, about a year ago, went remote, and I honestly am shocked at how productive I can be because I just can focus on the work being done. And it's not for everybody. Not everybody likes working from home, but I really do think that leaders should be considering if it's appropriate for their staff, because yeah, it can definitely make a difference to be able to actually get your work done and not feel stressed over that long to-do list and alongside all the fires that you have to put out. Oh, and thank you, Ashley. She says that they didn't realize that there's a difference between compassion fatigue and burnout. It is often overgeneralized. Yeah, I appreciate that, because that was kind of one of the hopes of this presentation. All right, well, Jessica, if you can kind of keep an eye on that, we can get back to more questions after, or once we get to the case discussion here. So we're going to move on to today's case, and I want to share how we've tried to put the U.S. Surgeon General's framework into practice here at NDCPD. So I want to start out by defining what organizational culture actually means, because I don't think I touched on that earlier on in this sessions. So organizational culture refers to the behaviors, attitudes, and beliefs that guide how people in an organization interact and work together. This encompasses both formal norms and implicit practices. And so at NDCPD, we have 106 employees on payroll, which includes 71 benefited staff. We typically operate between 25 to 30 grants and contracts at any given time, and we serve the whole state. So with that, we have about 47% of our employees who work remotely. And we know that our staff are prone to burnout because a lot of our programs provide direct support to people with disabilities from birth to end of life. So with that, and also knowing that we rely on discretionary grant funding, and the lulls in grant funding, especially during election years, can cause a lot of fear, anxiety, and low morale for staff. So NDCPD employees developed this culture statement that identifies the shared values, attitudes, and beliefs that encompass a workplace culture. We did this at a staff retreat last November, and the statement goes, at NDCPD, we strive for a culture where the environment is supportive, inclusive, and flexible, where individuals feel respected, valued, trusted, and empowered while doing meaningful and ethical work. So once we created this culture statement, we really had to figure out a way to keep the excitement and momentum going, because all too often organizations will develop something like this and then it just sits on a shelf and it's not revisited for years on end. And we didn't want that to happen. So that kind of led to the development of this Culture and Wellness Collaborative, which is an employee-led work group. And I do want to highlight that culture and wellness, when we're talking about culture, we're talking about the organizational culture, especially in the context of this culture statement that we came up with, not necessarily individual like ethnic and racial culture, but that does play a big role in it because we have done a lot of justice, equity, diversity, and inclusion training. So we've married all of this together, and we're still trying to figure out how to make sure that this is operationalized and making a difference within the organization. So this group is comprised of volunteers from different positions and roles. It is very outcome orientated, and our goal is to provide education and resources to promote and maintain a positive workplace culture. And I should highlight that this group is only 5 months old. We're still super early in the adoption process. So far, we've defined the culture that we want, and we're really trying to ritualize some of the activities that we think would make the most positive change. And we didn't want to go into this blind. So one of our first activities was assessing the workplace. And we used the Surgeon General's framework to develop an employee satisfaction survey that covered all of the different essentials, the feelings of safety and security, social support and belonging, autonomy and flexibility, and all of that stuff. We also included mental health measures to kind of get a pulse on like how people were feeling mental health wise at the time. And our hope was that we would see an increase as more activities and momentum occurs over the years. And I should note, like, this has only been five months that we've been doing this, so we don't actually have any outcomes yet. We don't know if this is working just yet. But after starting to assess the workplace, we analyzed the results and found that the areas of connection and community and mattering at work were the most significant areas of opportunity for improvement. So those are kind of the two areas that we focused on. 67% of staff agreed that we provide enough team building activities that are inclusive, but 33% said that the team building activities were not inclusive. And as a reminder, 47% of our employees work remotely. So we took an inventory of what team building activities do we have? We have monthly soup days, birthday celebrations, holiday decorating contests, book club discussions, and most of these are only offering meaningful engagement for those employees that are at the main headquarters. So we interpreted these results as an area that would benefit from strategies and recommendations that help include remote employees in these different traditions. Mattering at work, we found that employees expressed a desire for recognition and feedback that acknowledged their expertise, contributions, and impact of their work. So we used all of that to develop a work plan. I'll go ahead and show you, since we have a little bit of time, what our work plan looks like. So we developed a needs statement. We have some initial success metrics that we're going to be keeping an eye on, and we'll probably be administering the staff satisfaction survey after some of our activities have actually been adopted. We highlight the work group's purpose. We highlight the mission, the vision, the values of NDCPD. Like I said, we took inventory of all of the things that we're currently doing at NDCPD, and then we tied it to the Surgeon General's framework just to kind of keep that in context of what areas maybe we need to grow and expand on. And then we created a work plan with different tasks, and we're keeping track of progress. So far, the only activities that we've really been able to work on is the very first one, which is maintaining excitement and promotion of the culture statement. I will go into that in a little bit more detail in the next slide. So some of the things that we've done in these short 5 months is defining the culture statement, using the survey results to create that work plan. The very first activity, we started creating these discussion prompts to help understand how individual team members interpret the meaning of the statement. I believe there's 9 different words in our statement, and some of them are kind of heavy. And we were like, how do people interpret this? How do people conceptualize these different words? So we have these prompts that have just 4 different questions of like, what does respect mean to you? Is there a time where you felt incredibly respected and supported in the workplace? What did that look like? Is there a time that you felt disrespected in the workplace? And people can have these conversations in their individual teams so that we have just a better understanding of how to work together. And we also recently started an initiative to host discussions on employee wellness and organizational culture. So in April, we had a talk on compassion fatigue, and it was really informal. All we said was, here's the definition of compassion fatigue. Do you have any experience with this? What are some resources or best practices that you do for self-care? And it was just a nice, engaging discussion on compassion fatigue. And not everybody had to. People could just come and listen. They didn't have to engage with it. And we were pretty happy with how that turned out. But that was only our first one. So this month, actually, tomorrow, we have a webinar viewing that talks about organizational culture. And then we're going to have a discussion afterwards. And we're hoping that we have similar engagement with that. So those are the successes that we've had so far. Some of the barriers have been communication. There's a lot of people that don't understand the purpose of the Culture and Wellness Collaborative, which has caused some confusion and people feeling unsure if it's working, expressing frustration that there's been a lack of change. So we haven't been clear in communicating that organizational culture initiatives take 3 to 5 years to actually work and make any sort of change. So we need to get better at communicating that. Initially, we had some difficulty with engagement and participation, and also time. This is a side project. Like, we all are on grant funded projects. And so we just run into barriers where it's like, oh, we have this meeting on our calendar and didn't have time to actually prepare for it because we've been busy with everything else, such as Echoes in May. So some community discussion. We would love for you to engage with us in the chat, or if you're comfortable, please feel free to go ahead and unmute whatever you're most comfortable with. How can we better communicate the purpose, progress, and realistic expectations of what we're trying to accomplish with the Culture and Wellness Collab? I'm going to turn on music once again because it makes me feel more comfortable and allows me to actually give space and silence for people to put in their comments. And also, there's no right answers. Just whatever you think would be most beneficial. And if that one feels like kind of a loaded question, we could also, how do we prepare our staff to be resilient while carrying out this initiative? It can feel very defeating when people are questioning why, or questioning and making comments that this isn't making an impact. Karen says, I find it helpful to know why changes are being made and how they will be beneficial. That is excellent. And I don't think that has been communicated, honestly. I think that we've communicated it, but obviously it hasn't been very clear. Clear goals, sending a consistent message, absolutely. Show your staff the progress that's been made and give them credibility for their job well done. That is excellent. Thank you, Sydney. And it's important that all members of the leadership team have the same message for staff. Absolutely. I did forget to put in here that we have 100% leadership buy-in, which is kind of the first thing that you need with any sort of initiative like this. So it's been interesting that it's not leadership that we're trying to buy in, it's staff. Also appreciate everyone who's putting emojis under people's input. That's really great. All right. Well, I thank you guys so much for that input. Feel free. Oh, the message should be with a positive attitude as well. Absolutely. Well, this is really great feedback and we appreciate it. We'll definitely take this into consideration as we progress with this, and hopefully we have an update. We have an annual staff retreat. Thanks, Rebecca. I love this. I love this playlist. I can put it in the chat if you ever want to listen to it in the background while you're working. Um, but yeah, so we have an annual staff retreat every single year, and I think that this will be kind of a primary focus. So I think that these suggestions will be really, really great um, as we move forward with this. Also, I'm seeing that some people are afraid of change and don't want it to succeed. It takes a lot of effort to help be part of the change, and many people with compassion fatigue don't have the energy or capacity. And that is an excellent observation. I think that we have definitely experienced that. We've had a lot of staff loss over the year, and people are really just trying to get by in just the regular day-to-day stuff. So that's something that we can definitely be more aware of and compassionate towards, if that makes sense. Thank you. Thank you. Please keep putting stuff into the chat. Some tools for replication. If you are interested in doing something like this, you don't know where to get started. One, read the Surgeon General's framework. Read it, highlight it, get used or really get familiar with those concepts. And then once you get started, we use Microsoft Forms to do our employee satisfaction survey. We use Canva for our strategic plan template. I believe Canva gives you the free paid version if you're a nonprofit. And we also use Chat PDF to analyze our qualitative or open-ended results. We had some people that wrote almost like a chapter book in our employee satisfaction survey, which was wonderful. It was like wonderful insight, but it made it very, very hard to find themes in those results. So we used Chat PDF, and then we kind of compared it to our interpretations and what they had said. Here's all the references to today's sessions. Thank you, Jessica. She says that Canva will allow nonprofits to access their pro version for free. It's a simple application process. Thank you. Yeah, Jessica's the one who got it for our organization, and her and I are on a team. I think Jody's been added to that team so we can all collaborate and access each other's templates. So it's been a life-saving tool because I'm somebody who prefers when things are graphically pleasing. So it's been really nice to just have access to some of those templates. So any other questions that we may have missed during this session that you would like answered? I will try my best. Oops. Go ahead and stop sharing. Well, with that, we appreciate you so much for being here and all of your wonderful input. Kyle is going to send out a feedback form. So if you are looking to receive social work or nursing credits for the session, we ask that you fill this out in order to get your contact hours for this session. I have a question here. How do you confront a staff member that you recognize has the start of burnout without feeling like you're intruding their space? That's a really great question. And maybe reframe it from confront to provide support. You can pull somebody into the office and be like, hey, you know, I noticed that maybe we're starting to have some increased use of sick days. How are you doing? And what's on your mind? And just give them that open question so that they can just have that space and they can use it how they want it. It doesn't feel confrontational. And once they tell you what's on their mind, just give them space and say, and what else? And try not to give too much advice right away, and see, then you can ask them, like, do you want some resources? You know, I found this great survey that provides additional resources. So it's not you becoming the counselor, because one, you probably don't have the credentials to be a certified counselor, and two, you just can't do that because it's going to suck up all of your time and energy, and then you're going to become exhausted and have that same fatigue. So we really want people to um, be able to feel like they can come to you for support, but also get outside help when it's needed.
I can add as well, on my A-STEP program, I manage anywhere between 20 to 60 college age students who are either volunteers or practicums or paid mentors. And I have noticed at times people having errors or showing the signs and symptoms of compassion fatigue. And I'll do what I call a check-in with them, to where I just ask, if they have time to meet up with me or have a phone call, and just ask, how are things going? I know you're on a really difficult shift with this student, and do it as more of a, hey, how are things going? And then after I get that feedback from them, I can provide advice or reminders. Remember, we need to do this. Do you maybe need to be put on a different shift? Do you maybe need more training or support? But I do it in a very, I guess, I don't know a better word to say than caring manner. And I feel like it's, for me, it's never gone wrong. So that would be my advice.
Thank you, Jessica. Absolutely. Yes, caring is absolutely key in all of this. And you can refer people to EAPs, but I do want to highlight that, with your employee assistant programs, like they do offer counseling services, but going to counseling is hard. Like people tell you to shop around for a counselor that kind of fits. And if you're already in that state of exhaustion and fatigue, and also maybe just not mentally well, you don't have the time to shop around for a therapist. And so I think that really showing support in the workplace, maybe giving them some additional time off, and asking specifically, like, what can we help you with, is way more helpful than just saying, oh, use the EAP. Not that there's anything wrong with that, but there's just other ways that you can approach it for sure that comes off as more helpful, instead of you just trying to dictate, what you think people should be doing. Yeah, it is. It's often hard for people to acknowledge that they could use counseling. Absolutely. And it could be because it's stemming from personal experience with it failing. Um, After my dad had passed away, I tried to go see a counselor and it wasn't a good fit. I felt like I was being interrogated, and I just left feeling so bad. And I didn't go back to counseling for about a year and a half after that incident, because I was like, oh, this is pointless. Like, I just don't have the energy for it. So, and yeah, as helping professionals, it feels strange asking for help. So one way we can get people to start asking for help is acknowledging that it's okay to ask for help. It's okay that you will feel compassion fatigue. You don't need to be you don't have to feel shame or guilt when it happens, because it's just going to happen on this job. Here's what we can do to help support you through that time. And like I said, for the sake of time, I cannot go into every single resource that we can do. So we hope that you enjoyed this session and you want to come back for more, because we have plenty of sessions that go a little bit deeper into how to do this, especially, um, yes, Jessica, finding the money and resources for counseling is hard. Finding the time for counseling is hard. Absolutely. Absolutely. Well, once again, Kyle, if you could put the evaluation into the chat, we really, really appreciate your feedback. We use that to improve our sessions, and it also is really great for our funders, so we can continue offering series like this. And we hope to see you next week for our session featuring Dr. Beth Livingston and Dr. Michelle Williams, who are going to talk about creating cultures of community inclusion and belonging, and building those trusting relationships with your staff. So thank you so much. We'll give you guys the gift of time of 4 minutes.